Good afternoon, guys. This afternoon, what we're going to cover is your rapid health assessment. This is your initial impression of the patient. We're going to expand what you've already learned with your cardiac and respiratory system, and we're also going to dive into a complete health assessment. First thing and the most important thing you learn as a nurse is doing a good assessment. And the key to knowing this, I've found over my years of experience, is doing this rapid health assessment, your initial impression. So the initial impression is the first and lasting impression you will have. It will help determine what you do with that patient. For example, you can't go ahead and complete a full health assessment if the patient's not stable. If the patient's stable, then you can continue. So this is what we're going to talk about, and we'll see why it's so important, okay? The book just talks about this rapid health assessment as your pediatric assessment triangle, and what that is, I refer to it more, think of it more as your ABCs, kind of like your BLS, your airway, breathing, and circulation. This is more appearance, breathing, and circulation. So if you kind of think about that when you first walk into a room, you do those pretty much simultaneously, all at the same time. And you just look and see, no touch, what your patient's first impression is, how they're doing, how stable they are, and then you can move on from there. So like with your appearance, we'll dive into these individually a little bit more, but your appearance, what do they look like? Is there tone? Are they alert, active, responsive? Are they looking at you, talking to you? If not, it's a red flag. And same with the breathing. How are they breathing? Are they working to breathe at all? Are you seeing any abnormal breathing patterns? Hear any abnormal breathing sounds? Are they working to breathe with retractions or nasal flaring? And then we'll move on to circulation. What's their skin color? So I'm going to give you a scenario. I want you to envision you work on the med-surg floor, and you have a new patient. All you know about this patient is that he's 4 years old. He was admitted for croup. He has a cough and congestion and no fever. Doesn't tell you a whole lot, right? So what are you going to need to do? You're going to have to take a look at the patient, and then that will help determine what's going on with the patient. So just watch this clip and think of your ABCs that we just discussed, and see what your first impression of this patient is. All right, so what did you observe with his appearance? What was his body tone? What did you think about that? Did you think he was he was sitting up on his mom's lap, but was he looking at you? Not much. We can kind of go back to that triangle, so we can kind of hone into each category, kind of what you're looking for. Like we said, he's sitting up. He's not really responsive to you. He's not talking to you. Is he like your normal 4-year-old child that you see running around in the streets if you've never had children? No, not really. Most 4-year-old kids, especially boys, are very rambunctious. They're just running around rampant, and they're talking, they're moving, they're interacting with their life. This child is not. He's not looking at you or mom. He's not talking. He's not really responsive to his environment at all. He's just kind of, all he's really doing is just sitting there breathing, and barely at that, right? So that's kind of red flags to you. But let's go ahead and look at his breathing and watch when this clip. I want you to focus on what you see and hear, okay? Working a little bit, huh? All right. Did you hear anything when you watched that clip? Yeah. Is that normal? No. His breathing, any type of breathing, should be pretty much silent. Anytime you hear any audible sounds, without your stethoscope obviously, should send a red flag that something's going on with his respiratory system. So anybody know what that kind of audible sound was? Yeah, it was stridor. Stridor is very common with croup. You don't always see stridor. Stable kids with croup do not typically have to have stridor. Sometimes you'll hear that more when they're upset or crying or coughing after a big coughing spell. But normally just sitting there should not necessarily hear that stridor sound. So it's kind of a red flag that something's wrong. What else did you see? Again, we're going to go back to that triangle to kind of help you think of maybe else what to look for. Did you see any abnormal breathing patterns? Yeah, his breathing was kind of seesaw. So his chest and his abdomen was kind of doing this breathing up and down kind of movement, right? What does a normal breathing look like? It's usually just more the chest moving up and down, right? And so that would be normal, but his was abnormal, right? What else did you see? Did you see any nasal flaring? Not really, not that we could see. He may have been doing some nasal flaring initially and then progressed. That's usually how the progression works. It starts with nasal flaring and then the progression of that retractions will go on from there. And if you remember back from the respiratory system that we discussed before, the retraction is using your accessory muscles. So his lungs are now tired and they're kind of not responding well, and they're using those accessory muscles to kind of help him learn to inhale and exhale. So that's where you're seeing those accessory muscles, and so that's a really bad sign for kids. They should not be doing those retractions, and so anytime you see that, just red flag that something's wrong with that patient. Anyone want to guess what kind of retractions he was doing? Yeah, definitely you can see some intercostal retractions. And if you probably even repositioned him a little bit, you might see a little bit different of retractions because that side view is kind of obscures some of what you could potentially see as far as his retractions, but definitely the intercostal. And some of that seesaw breathing also kind of obstructs. He very well could have been doing some substernal as well, but that seesaw kind of hides out a little bit. So you know that is a red flag for sure, and he needs further care. And looking at so far what we've seen of this child, would you put him in more of a distress or failure category? Yeah, I mean, you actually, he's more of a distress than a failure, but I could see why some of the categories he kind of fits under. So let's begin. His airway. His airway was open, but with that stridor sound, it means that he is starting to have an obstruction. His airway is starting to narrow, and that's what gives you that inspiratory stridor sound. It's because of that obstruction. So he's not fully obstructed, but he's starting to get that obstruction for sure. He was breathing a little bit fast. Short clip is kind of hard to gauge how fast he was breathing, but estimated about 34 breaths a minute, which for a toddler, 20 to 30 is your normal, so 34 is a little bit more than normal. But I'd rather a child breathe a little bit faster than slow. Slow means that he's impending on doom. He's not doing well at all. So, I don't like either one of them, but if I had to choose, I'd choose breathing fast. Definitely saw an increased effort. He was definitely working to breathe. We definitely saw that. No respiratory effort means he's not breathing at all. So, not a good sign. Definitely did not have clear sounds. We definitely audibly heard that stridor. So we know that was an abnormal finding. And then tachycardia, it's hard to know because we don't know what his heart rate is. But most of the time for kids who are breathing fast, heart rate's going to be elevated just because their heart's compensating, trying to pump the blood throughout to get oxygen through the whole body. So it's probably going to be tachycardia. He definitely wasn't anxious or agitated. but it wasn't a complete failure to respond. I'm sure if we kind of shook him, touched him, he probably eyes would have flickered. He may have even glanced us at, but he wouldn't have given us a whole lot of effort to his movements. Because he has to focus on his breathing at this point. And his color of his skin. We'll talk about that next. And this is going to just show you that clip one more time, but I'm just going to show you really short because we've watched this a couple of times. But I want you to kind of look at his skin compared to mom's, and that will help you determine. And even if you don't know, because you've never seen this kid before, is this normal? Ask mom. Mom will tell you if this is a normal color for him. So you can see they're both very fair-skinned individuals. So, you know, saying he's pale is kind of hard. But if you compared it to mom, you could say he's a little bit pale compared to mom. Did you think that he was modeled at all? Not really. Didn't see any modeling at all. And then cyanosis, it's kind of hard to see the view that we had of this clip. Maybe if we zoned in into his face, you might see a little bit of the cyanosis around his lips. It's hard to say. But what we do know, and this is what you do need to make sure you elevate, because obviously you saw a lot of red flags, correct? And so what we're going to need to do at this point is kind of give a summarization to your provider so they can elevate care or treatment for this child, and so everything will improve. So basically, you know, if you treat the respiratory system, then you're going to see an improvement of his appearance. You're going to see improvement of his circulation and his breathing. So all of that is, you know, based on treatment, but you know, you won't be able to have that treatment until you elevate that care for that to that provider. So this is some of the things that you will kind of summarize your ABCs to your provider. You're going to tell them that you have a 4-year-old male who was diagnosed with admitted for croup, and he's not really responding to his environment. He's somewhat awake, but he's not responsive. He's not talking. He's not looking at you. He's just really concerned. And then his breathing. We've talked about that he's working to breathe. He's doing that seesaw breathing. You can hear the audible stridor, and he's retracting. All signs that you're worried about this patient. Color of the patient is pale. Not such a big concern, but overall, all of them kind of sum up that this patient needs further evaluation. Did you guys have any other questions or concerns regarding this? Because if not, we could move on to the next full assessment. No? All right, thanks.